It's very lovely to be on your screens again. Today we have a very important topic, but before I jump in, I'll introduce my co-host Cordelia. Hi, Cordelia.
Hi, Doctor. How are you?
I'm good, thank you. Looking lovely as usual.
And so are you. Really good to see you. It's been a minute.
It,
Look
it has
absolutely
been.
gorgeous.
Thank you, thank you, thank you, Cordelia. So today we are delving into a very sensitive topic, not not a strange topic, but very sensitive. Um, we gather that most times people who avoid booking an appointment with a GP are not doing so to check out their symptoms because they are scared of what would come out of that phone call. And we know that cancer is ravaging in every way, in every form. So our topic today is going to border around talking about getting yourself checked, especially when you notice symptoms in your body, wherever you notice, however you notice, and no matter how small it is, taking your health a bit more sensitively and seriously. And to help us discuss this evening, we have two important guests, an NHS GP, Dr. Aziza Sesay. I hope I pronounced the name correctly.
Yes.
Hello, Dr. Sesay.
Hello.
It's a pleasure to have you here this evening.
The pleasure is all mine. Thank you so much for having me.
Thank you. Thank you. And we also have one of our favorites who you've seen here before. And it's our very own Reverend Marjorie. Yes, I'm away. You're all welcome.
Thank you. It's an honor to be here.
The pleasure is ours. Reverend Marjorie is the president and founder of Wisdom for Women International, and that's a women's ministry. It's really a pleasure. It's a pleasure to have you here.
Thank you.
So I think the first question should go to the doctor, because I know she will know firsthand what I'm saying, you know, the fear that we are recording, where people are not getting themselves checked when they need to get checked, or when they suspect they need to get checked. So my first question would be sort of obvious, but for the sake of the people who are watching and who need to hear this again, who is most affected by cancer?
That's such a brilliant question. It's an important one that we definitely have to answer. So men and women over the age of 50, and those often from working class backgrounds, are more likely to be diagnosed with cancer. And actually from studies, we know that Black and South Asian communities are at higher risk of being diagnosed with cancer. So I'm here to tell all the viewers why it's really important, please, to come and see us, come and see your GP if you notice anything different in your body or if something doesn't feel right. Because the truth is, when cancer is diagnosed early, then it's more likely to be curative. The treatment's more likely to be successful and less invasive. And I know, like you said, cancer is a scary word and people avoid. But the truth of the matter is avoiding it doesn't make it go away. And actually what we're doing is we are causing a detriment to ourselves, because the later the cancer is diagnosed, the worse the outcome. We have seen that referrals for suspected cancer are at a record high level. So like you said, it is ravaging our community, big communities. And we need to continue the trend to diagnose cancers early to improve the outcomes, because a recent statistic found that 17% of people are worried about cancer every single week, right? And that rises to 14% of the Black community respondents. So the whole community is 17%, but 14% of the Black community are scared, with 10% being scared of cancer every single day. So I know it's scary, but please come and see us.
You've mentioned, well, you started off by saying, you know, men and women from age 50, and then working class people. Yes. But how does this affect everybody else, really? Because we do see people who are not up to age 50, not working class, getting cancer. So should those ones be careful as well?
Yes, everybody needs to be careful, but statistically, people who are at the highest risk of developing cancer are people who are over 50 and from the working class group, and Black and South Asians have the higher risk. However, cancer doesn't care how
No,
old
it
you
doesn't,
are,
does it?
what you do, where you work, who you know. It doesn't matter how much money you have. It can affect anybody at any stage. But yes, because your question was, who does it affect the most? Those groups are the ones that get affected the most. But actually, I'm really glad that you pointed that out, because we are seeing younger and younger people under the age of 40 being diagnosed. So these figures are what it currently is based on research that has been done in the past. But I feel like in 10 years' time, the figure might actually be lower than what I've just stated.
Yeah, I would imagine so, because I mean, everybody knows somebody these days. Everybody knows 2 people, 3 people, not just one person. So I can imagine what the stats will say now, you know. So what are these common causes of cancer? Where is cancer coming from?
Yeah, that's such a brilliant question. And the truth of the matter is the causes can vary depending on the individual. All of us have our own individual risks that we're born with. And there's environmental factors that then trigger it off, things that we do that trigger it off. Now, there are lifestyle factors that are that do increase the risk of cancer developing. And actually, the World Health Organization says that about 30% of cancer deaths are preventable because they're linked with 5 of the leading lifestyle and behavioral factors. So these are things like smoking, drinking excess alcohol, being obese or overweight, not doing any form of exercise, and not eating any fruits or vegetable. And the truth of the matter, if we think about it, loads of people smoking, loads of people excessively drinking. The society is becoming more and more obese. We're not exercising. We all have sedentary lifestyle. I mean, the COVID pandemic definitely increased that because we're all sitting down. We're not, going to work anymore. We're working from home. So that exercise is gone. And we don't eat as much fruits and vegetables. A lot of us are eating processed food. We're eating red meat. All these things are playing parts. But like I say, we also have our own individual risks. So sometimes you may have inherited faulty genes from your parents, which then increases your risk. But having said that, just because it runs in your family or you've inherited a gene, it doesn't mean that you will definitely get cancer. You just need to be even more cautious. But I feel like regardless, everyone needs to be cautious and be health conscious so that we can help improve our outcomes and reduce our risk of developing cancer.
To you again, Dr. Cisse, of just terms of lung cancer, which is another issue that seems quite predominant. What are the symptoms to look out for?
Specifically for lung cancer, the top one that we always talk about is cough. And if you have a cough that's lasting 3 weeks or more, please go and see your doctor to get checked out. I'm not saying that you definitely will be diagnosed with cancer, but at least then we can do the checks that are needed. Often the first step is doing a chest x-ray. Also, if you have a cough in which you're coughing up blood, if you're persistently coughing up gunky phlegm, so it's brown or mixed in black, that sort of thing, please get it checked out. If you notice that you're getting chest pain, if you're getting worsening shortness of breath, just walking up and down the stairs, which would never cause you shortness of breath in the past, those sort of things, please get it checked out. Also, if you notice that you are feeling extremely fatigued, more fatigued than usual for no reason at all, and you can't really pinpoint what's causing it, if you find that you are losing weight, and that's been going on for, say, 3 weeks or more again, and it's unintentional, these are all potential symptoms of lung cancer. And honestly, the first thing I would say to do is please go and see your doctor so that we can assess you. We'll check you over. We'll listen to your history. Again, we'll find out what your risk factors are. We'll examine your chest and so on, and then most likely refer you for a chest x-ray. And then if we're really concerned, we refer you on to the specialist clinic. So in the UK, the NHS, we refer under what's called a 2-week wait. And the aim is that you get seen within that time, essentially.
Another question I'd like to ask really is to do with non-smokers, because we all know the risks that are linked with smokers to cancer. Can non-smokers get cancer?
Unfortunately, the reality is anyone can get cancer. So we see young, fit and healthy people who exercise, who eat healthily and do everything that they need to do. But unfortunately, they're one of the rarer cases that get diagnosed with cancer. And I'm not trying to scaremonger anyone here. The whole point of these conversations is so people go and get seen early, because we know that if people get seen early, when they first notice the symptoms, then they're more likely to be diagnosed early. And if they're diagnosed early, they're more likely to have treatment that is curative, less invasive, and successful. This is the key. We know that 83% of people who get diagnosed in the earlier stage are more likely to live longer. And that's what we want. So please, 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 I know it's easy for me to say, please look past that fear. Come and see us, get the test done. Because guess what? Majority of the times, it's not cancer, and you remove that worry from yourself, then you don't need to worry about it anymore. You had all the tests that you needed, and you can calm yourself with the fact, reassure yourself, and we also, as your doctors, will be reassured that it's very unlikely to be the case.
If the GP refers me for a test, for example, what should I expect?
So it really depends on what test they are referring you for. So if they say that you need to go for an ultrasound scan, you would be seen in clinic where they would do the ultrasound scan. If they need to refer you for a chest x-ray, you get the chest x-ray done. If they refer you to a specialist, like if we talk about, say, for instance, if you found a breast lump and they refer you to breast clinic, there they would often do a full test. So they would often do an ultrasound scan. They may even do a mammogram. They may do a biopsy of the lump to find out what exactly is going on. So it really depends on which specialist clinic that you see, but oftentimes they will talk you through what would happen and what to expect. And as you go along, you will have the information.
Hi, I'm June and I want to talk to you about lung cancer. I was diagnosed with lung cancer in May 2022 when I was 63 years old. At the time, I felt like my energy levels had really dropped. Didn't feel myself and was really tired most of the time. I knew something was wrong, so I called the GP and I'm so glad I did. I got my diagnosis quickly and I had the tumour removed within 2 weeks. It's really important to contact your GP if something isn't right. If you have a cough for over 3 weeks, feel out of breath when doing normal tasks, or have unexpected tiredness and weight loss, it's time to get help. Even if you're already using herbal remedies. Everyone thinks that only smokers get lung cancer, but it isn't true. I've never smoked and I still got it. Early diagnosis can save lives, so if you have a cough that's lasted longer than 3 weeks, please make an appointment at your GP practice. Visit nhs.uk/cancer symptoms for more information.
While you've been speaking, Dr. Sese, you've been, branching off and covering every area. But as you say, the reason we're here today is to give that push to the public to say, get yourself checked. So what happens, as a way of emphasis, as a way of, what are the benefits of diagnosing cancer early?
Okay, so as I say, if you get diagnosed early, cancer is divided into stages. So there's stage 1, 2, 3, 4. Mm-hmm. Stage 1 and 2 are often classed as the early stage, and stage 3 and 4 are later stage. Stage 4 is when the cancer is spread to different organs, and usually at that stage it's incurable. Okay, so in that stage, they're basically managing the patient to try and prolong their life as much as possible, but it's very unlikely for it to be cured. Now, if you get diagnosed in the earlier stage, then we are more likely to treat it completely. We're more likely to cure it, and we're more likely to have what's called less invasive procedures. So rather than doing a massive operation where they remove big portions of wherever the cancer has spread to, it will be a smaller operation and it won't be as invasive, which then means that the time for you to recover is less, and hopefully the side effects is less than what you would have encountered if you had, more advanced cancer. And as I say, it's more likely for it to be successful. And the prognosis, so the outcome, is positive. That we know for sure. Cancer that is diagnosed at the earlier stage means that people will live for 5 years or more compared to people who get diagnosed at a later stage. It's usually between 80 to 90% that people get diagnosed at an earlier stage will live longer than people who are diagnosed at a later stage.
Okay, so what happens when a person gets diagnosed? When a person gets diagnosed, what next?
That would obviously be a difficult time for anybody. Oftentimes they will be referred to a Macmillan nurse. So that's the nurse that talks them through their cancer, give them psychological support, all of the support that they need. Once they get diagnosed, we try and stage what level the cancer is, as I said, between 1 to 4. And then depending on that, the oncologist, so that's the cancer specialist, will then decide on the best course of treatment for the patient. Now, it varies depending on what type of cancer it is. Sometimes they may initially give chemotherapy or radiotherapy to try and shrink the cancer first, and do a surgery, or they may do surgery first to remove the cancer and then give chemotherapy and radiotherapy to try and get rid of it completely if there are any remaining smaller cells. There's also treatment known as immunotherapy. So this is newer, innovative treatment they started giving, which is essentially where they get your immune system to fight off and kill the cancer cells. So you have that option as well. But as I say, it really depends on what type of cancer the person has, what stage of cancer the person is, and also on what the person's health status is as well. So imagine if it's an elderly patient who has multiple, what we say comorbidity, multiple different diagnoses and so on and so forth. We have to factor that in. That then plays a part in what treatment recommendation that we give, because ultimately the treatment that we give, it's really strong, and the patient needs to be strong enough to be able to withstand it, to be able to tolerate it. So it's a risk-benefit thing, isn't it? Will we be doing more harm if we do the treatment, or should we just leave them to be comfortable, to get to the end in a more comfortable state? Or do we do everything that we need to do, and without risking any harm to the patient? Do you understand what I'm saying?
Yes, I do understand what you're saying. I do. What can you tell us about cancer reoccurring?
If you've had cancer before, there is a risk that it can come back. So rather than use the term cure, they often say the word remission. So remission means that the cancer is sort of at bay, or they even use the term no evidence of disease. So that's where they've done, say, a full scan and they can't see any cancer using the imaging or the technology that they have. They cannot see any evidence of disease. But that doesn't 100% mean there's no cancer at all. So that's why anyone with cancer is often surveyed for a period of time. Some people may have 3 monthly scans, and then once they've gotten to a certain level, it's done every 6 months. And once they've gotten to a certain level, it's done every year, and so on and so forth. But they are surveyed constantly. And another important message to say is if you've had cancer before and if you've been treated, you still need to be very, very vigilant about symptoms. If you find even the slightest change to what your normal is. So that's another message. Know your normal, know your body, understand your body, and do your self checks every single month. Please check your breast, check your skin for any moles or any new skin lesions, check your mouth, check your vulva, your penis, your balls, everything. Check all aspects of your body and do this regularly. We often say at least once a month. The reason being is if you're doing these checks regularly, you're more likely to know what's normal for you, and you're more likely to pick up even the tiniest change. And that way you get to see your GP earlier. Please go and see your GP as soon as you find the tiniest change, because again, it means that hopefully if it is cancer, which again, as I say, is rarely the case, if it is cancer, it's picked up early, the treatment is better, the treatment is more likely to be successful and curative, and the prognosis is most likely to be better as well.
It's a good thing you talked about knowing your normal. So I was noticing a funny change in bowel movement, and so went to the GP, got a stool test. I wasn't seeing blood in my stool, but they requested for, and it turned out there was blood in my stool, but it wasn't visible blood. And so they sent me for a colonoscopy. So I actually had the colonoscopy, but thankfully that came out clear, you know. And just like you said, sometimes, you know, I mean, it has turned out to be, they've ruled out all the major things, I would say. It's turned out to be something like IBS, maybe. So it's better I know, because it's very scary, isn't it? It
must have been really scary when you're going through that whole experience.
Yeah, and they moved so quickly, which was even scarier for NHS. They moved really quickly. In the space of a week or two, I was having this procedure, and I'm like, what are you doing here?
I understand.
I'm asking myself, what on earth are you doing here? You know, so that's really good. I think it's a good place to go on a break. You know, we've been listening to very heavy stuff this evening, and so we will go on a break, and we will be right back talking to Reverend Marjorie Osamaway. Please don't go anywhere. See you shortly. Welcome back, everybody. We're still on the topic of getting yourself checked for cancer. And joining us, or with us already, is our very dear Reverend Marjorie Osamaway. And we all know that she's a woman for the women. So we would bring her in as such, you know, asking her opinion and what she thinks and why we should, you know, listen to what Dr. Sese has said. So, Dr. Marjorie, welcome again. So tell us why you would encourage us to listen, to get ourselves checked.
Thank you so very much. And thank you, Doctor. That was an amazing exposition. I'm going to look at this from the Christian perspective, if I'm allowed, because that's the community I minister to and I speak to mostly. Two things are very clear here. Health is wealth. And like you said, and Dr. Sese said as well, it's important that we check early and that we know our body. Our life is precious. Our life is very precious, not just to us, to our family members, to our friends. And that's why we need to take our health very seriously. And then health, early detection, it's so crucial. When you detect early, then you're able to deal with the situation intelligently. And you're also able to pray intelligently as well. And if it's okay, I'll just read the scriptures, because I know some people there might be thinking, well, as a Christian, maybe I shouldn't bother. But the Bible says in 3 John chapter 1 and verse 2, dear friend, I pray that you will enjoy good health. And so God wants us to enjoy good health. And that's why it's important that when you have a doctor, you connect with them once you think there's something not quite right. I think that's the right thing to do. That's the intelligent thing to do. And I encourage every woman watching, Christian, Muslim, everybody, non-believer, everybody, please check if you find something is strange around you and around your body.
Thank you, Pastor Marjorie. And it's interesting, you know, you went down that route, because some people would, argue and be confused and, go round and round about where medical treatment, faith, and healing, how they go together. So if you would say more about how these three things would balance. So going to the doctor, having faith, this is our community and this is what the
Faith,
things that go
yeah.
on. So we need to talk about it.
Faith and healing and medical treatment, I think they can work well together. It might be interesting to note that one of the disciples of Jesus, Luke, was a medical doctor, and Jesus took him into his team. And I think that was indirectly saying he's the healer. In fact, he is the great physician. But it's okay to see your doctor. Otherwise, I don't think he would have a medical doctor in his team. And then let me quickly read, because it's important that we speak to people of faith, no matter your faith, no matter what you believe. It's important that we speak to ourselves. This is Jesus himself saying, Matthew chapter 9, verse 12. When Jesus heard this, he said, healthy people don't need a doctor, but sick people need a doctor.
Absolutely.
Sick people need a doctor. And it's not sin. It does not negate your faith. It does not cancel your faith. When you see the doctor, again, like I said before, you're able to deal with the situation intelligently. You know exactly what is wrong or what is right, because it's not always wrong, like our doctor has rightly said. Sometimes we just live with a fear, and when you check, you find that it's really nothing after all. And that's why we need to see the doctor.
Absolutely. And indeed, even when you are a spiritual person, you still need your flesh to have a right to live in the earth. So we're not spirits moving around and ghosts moving around. We're people with flesh. So you need to look after that flesh, isn't it?
With regards to what Pastor Marjorie said, which really stuck in my mind. So she said healthy people don't need doctors, but sick people need doctors. But we need to remember that there are some people that may look healthy, they may be apparently healthy, right? That they don't have any symptoms, but actually have something within them, okay? And that's where I wanted to draw on the importance for all of us to attend our screening appointments. So in the UK, we have the NHS cancer screening pathways. So we have the breast cancer screening, we have the cervical screening, and we have the bowel cancer screening. These are all free tests. The GP usually sends you an invitation letter. Depending on which one it is, it's either you get called every couple of years, every 3 years, or every 5 years. This is something that you have to really please take seriously, because there are people who are being diagnosed with cancer earlier, or who are getting early changes that could eventually develop into cancer, that are being treated and cured before that's the case. So if you are between the ages of 25 to 65, you would be invited for cervical screening. If you're between the ages of 50 to 70, you as a woman, or if you have breast tissue, if you have a lot of breast tissue, so as a woman, you will be referred for a mammogram. And if you are between the ages of 60 and 70, I believe, you will be invited for bowel cancer screening. So please, 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 please take part in those. It will save your life. I promise you.
So when people come to you, Pastor Marjorie, what would you say to them if they come to you to say they're feeling this symptom and they are, surely they would be scared. What kind of advice would you give such a person?
The first thing would be to assure them that the information they've given to you is safe with you, because our health is private to us, and people want to know, I've just told you something that is very important to me, and I need to know that this is confidential. So you want to give them that assurance. And then secondly, when people come to us, my husband is a trained pharmacist. And so most people would come and they want to talk to us. You give them that assurance that everything will be okay. And then again, we kind of subtly, for those who think, well, I don't need to see a doctor. Most people would want to see a doctor, but they want the assurance of their pastor. But for those who don't want, we give them that assurance that go and see, explore the medical angle, because that's the way you're going to know what you're dealing with. Because the fear of the unknown is even worse than any other fear. So we kind of give them that assurance, push them towards subtly sometimes to say, you know, you need to see a doctor, you need to explore this further so that you know exactly what you're dealing with. And then we have Pastor Clem and I, that's my husband, we have a catalog of stories where we can just say, oh, we know of so and so pastor, and these are cases that are public cases, not, you know, quiet cases, people that have said, oh, I went through treatment and I came out successfully. We kind of have those catalogs and we throw it in to say it's not a death sentence. So and so went through treatment and they came out fine. So you can explore it. So we have, you know, a whole list of stories like that that we throw out now and then to encourage them to say, see your doctor. Somebody else has done that and they succeeded, you know, and it came out well. I mean, things came out right for them.
Because you are a woman of the community and a woman in the community, what would you say is or what are the most common questions you hear people ask about their health?
Mostly they want to ask you if you know about somebody else that has been through this. One of the questions they ask, because they want that assurance. And then secondly, they want to ask you diet questions. Again, like I said, because my husband is a pharmacist, would still find a way to say, you know what, I can give you advice, but it's better if you seek for professional advice. A lot of times when people come, they are afraid, they are scared. They don't know what this will end up with, but we keep giving that assurance. We keep telling them you'll be fine. Just take it one day at a time, and there's no need to be afraid. So, yeah, usually that's really questions are around the fear that they feel. Am I going to come out of this? Will I come through this? And we keep giving that assurance. You'll come through it. You keep them on the positive track. You call them, you speak to them regularly, but make sure that for us as pastors, we want to say, okay, we're praying for you because we believe in the power of prayer as well. We believe that doctors care, God heals, but we will still, you know, tell you seek medical intervention.
Medical help. Yeah. And it's really warm to hear that, you know, people can have that kind of place where they can go to get that help from, you know, fellow people with like minds. They have a community where they can mingle and get the support. That's the word. Yes, that they need. Thank you. Thank you so much, Pastor Marjorie.
I actually do have a few more questions for you, Dr. Cisse, if I may. So we're encouraging people to contact their GPs. And the thing with that is oftentimes it's so hard to be able to book an appointment with a GP. What is being done to improve these chances where one doesn't feel like they are, like saying, causing extra problems trying to get an appointment? What is being done to improve the chances?
I hear you. And, you know, the pandemic hasn't helped. So there are so many people who often say that they are struggling to see their doctors. But I have to repeat here that it is essential for anyone who's experiencing potential signs or symptoms of cancer to contact their GP. The earlier cancer is detected, the more likely that it will be treated. So we're encouraging anyone, please, not to put it off. If you're finding it hard to make an appointment, I will keep urging you to try. Please keep trying. If your GP surgery is one where they say, call at 8 in the morning, call at 8 in the morning every single day until you can get an appointment. I guarantee you will eventually get there. Please don't put it off. And I want you also to know that you are not bothering us. We want to see you. We want to help you. Please help us to help you. The NHS is investing millions of pounds of extra money into GP surgeries, and we are seeing a record number of referrals for life-saving cancer checks. So more and more doctors are in training. We have more GPs in training. So yes, anybody worried, please don't delay. Come forward. All the GP teams now have direct access to potentially life-saving tests for patients. So we're helping to cut waiting times and speeding up cancer diagnosis for tens of thousands of patients. And also the NHS is working to find new ways to catch and treat cancer as early as possible. So they're having what's called high street checks and community lung scanning trucks, which have already diagnosed over thousands of people in earlier stage. And they've also announced that staff in the high street pharmacies will be funded to spot signs of cancer, with training for pharmacists kicking off this month. So there's a lot that's being invested, and there's a lot that's being done to try and improve the shortfalls that may exist. But the key message here is, if at all you're concerned, please go and see your doctor.
Oh, that's wonderful. It's really good to know that a lot is being done in that regard with the NHS. Just leading up to that, what is the NHS doing to help patients get, like, especially cancer, people that have been diagnosed with cancer, get the treatment that they need? Like, what is being done right now?
Cancer is a priority. It's the biggest priority for the NHS. Okay, so a vast majority of the cancer services were actually maintained throughout the pandemic. And the biggest priority is to identify those people with symptoms and get them treated as soon as possible. They are trying to ensure that the capacity is in place to deliver test results and treatment. They're investing billions in extra capacity and working closely with hospitals to help them to optimize the performance of their existing cancer services. So they are trying. I know from the outside, it looks like what is being done, what else can be done, but this is a massive priority. We're doing so many campaigns. Only a couple of weeks ago, we ran the campaign, the NHS Busting Cancer Bus, which essentially was a bus that went all around the UK, 5 different cities, starting from, I think, Blackpool, if I'm right. It went to Leicester, and then it ended in London. And this bus was essentially trying to stop people in the main town or city centers to raise awareness about symptoms that are associated with cancer, to make sure that they get seen. And I didn't actually get a chance to talk about the symptoms to look out for, so I want to quickly just mention it before we end. So if you notice any of these symptoms, please see your doctor. As I say, it doesn't mean that you have cancer, but if it is cancer, at least it'll be diagnosed early. So again, treatment is more likely to be curative, less invasive, and the prognosis and outcome is more likely to be better. So if you have any tummy trouble, any discomfort, any diarrhea for 3 weeks or more, any blood in your pee, even just one time you see blood in your pee, see your doctor. Unexpected or unexplained bleeding, any unexplained pain that lasts 3 weeks or more, any unexplained lump, any cough that lasts 3 weeks or more, any unexplained weight loss that's completely unintentional, feeling tired, feeling unwell, and you just can't figure out what's going on or why, any heartburn or indigestion, any unusual pale or greasy poo, any of these symptoms, please see your doctor. I mean, some of these we often have now and then, but if these are persisting for 3 weeks or more, it usually means something might be going on. Speak to your GP, get the assessments done, get the investigations done, and hopefully, like I say, it's unlikely that it's cancer, but if it is, the hope is it's diagnosed early, so it's treated, it's cured, and the treatment is less invasive, and the outcome is much, 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 much better.
Okay. What should we do if, let's say, we have concerns about a loved one or ourselves?
Like Pastor Marjorie said, it's always good to have the faith. So talk it out. If you want to talk it out with your pastor or your community leader, your imam, your community group, Talk it out if you feel comfortable, or talk it out with your loved ones. Don't hold it within yourself. Speak to your GP about it as well. Having a diagnosis of cancer, even going through the process, can be very psychologically difficult and scary. So speak to us. We can refer you for talking therapies. If you have been diagnosed with cancer, they have the Macmillan nurses who can help you. They also have psychological therapies that they can refer you to in that regard. But yes, talk it out. Don't isolate yourself. Get all the information that you need. If you're unsure, ask the questions. Before you go and see any of your doctors, write all the notes down. Make sure you bring someone else with you, because sometimes taking all this information in by yourself is really hard. So if you have someone else there, they can sort of ask questions for you, help advocate for you, and fingers crossed, talk you through what had happened, just in case you may have blanked out, which happens. That's normal. But that's what I would say as an advice.
To those listening, cancer is not a death sentence. And also to say it's important that we don't assume the worst. Always keep it positive until you get the results. And if there are leaders, imams, pastors, community leaders at any level, we need to find a way to pass the message to our people that it's okay to see the doctor. Even when you can't say it, you can, like when I go to do my COVID test, my COVID jabs, I take a picture and just place it there. I'm not just putting it for fun. I'm telling the people that look at me, the people that think, oh, she's amazing, I'm telling them it's okay to do the same. I may not say a word, but that's exactly what I'm saying. So let's find our way to get our people to understand that it's okay, as much as we pray, and I believe in the power of prayer, but it's good to pray intelligently and to pray into what the real issues are. Thank you.
Thank you for emphasizing the need, to be mindful of our health, mindful of our bodies, mindful. Everything we've said today, is encapsulated in being mindful. You notice something, check. Even where you haven't noticed something, attend your screening, which is what Dr. Sese has just reiterated now. So being mindful, checking, making sure, not missing, not ignoring, very importantly, not ignoring if we notice anything. And that's the reason why we gathered here today, to bring this message to everyone at home, at work, wherever you are watching this. Be mindful, check, be careful. Early detection, you get a better chance. Dr. Sese, if anyone wanted more information about, cancer and what to do and symptoms, where can they get such an information?
So there is more information that you can get on cancer signs and symptoms. All you need to do is go to nhs.uk/cancer symptoms. You'll get a lot of information from there, and it's reputable, it's reliable, it's evidence-based.
Thank you so much, Pastor Marjorie. Thank you so much, Dr. Sese, for giving us this time. And I'm sure everyone sitting at home is also screaming at their TV. Thank you. We needed to hear this again and again. Thank you to my lovely co-host, Cordelia. It was nice co-hosting with you again. And we will see you again next time. But don't forget to go to our socials at Ladies Loud TV Show on Instagram. Thank you. See you next time. Bye-bye.
Bye.